see how that goes for everybody.
Yes, so guys, for those of you who don't know, Dr. Mark Hyman, he's on our AME list. We use him as much as we can as an internal medicine AME. He's going to go over and give a presentation. He's done this quite a few times, but it's a very good presentation on causation, which everyone in the room needs to focus and take notes on. But keep in mind, he said the slides are going to be in the folder, and also keep in mind that this is going to be recorded and on our network drive. Okay? Thank you, Doctor, for your time. We appreciate everything.
Okay, so here we go. Whenever I do my talks, I have to give a bunch of disclaimers, so I'm just going to pull you through that real quickly. You did not say what you thought I said. I did not hear what you thought you heard. Any statements, so now they're being taped, I'm going to be in trouble because you can come back at me. And hospitality is never making guests feel like they're at home when you wish they were. Okay. I also want to acknowledge my co-authors of the books and some of the folks. These are three of my boys a few years ago, and worked for them. Okay. So the majority of my comments today are going to come from this book. So this is one of the AMA Guides companion books. We have a few of them we've made. And so if you're using the AMA Guides, you have to know about the companion books, okay? Because they really indicate a lot of information that's not in the regular, just standard textbook. So because I'm one of the editors of the book, I do get paid when you buy a book. Now, trust me, the AMA makes all the money. I get less than $1 for every book that's sold in the United States or internationally. So I'm keeping my day job. This is not a big amount of money. Okay. Another book that we wrote for the AMA Guides is Workability and Return to Work. Again, I'm editor, there's royalties, but I don't think we're going to be covering too much of that today. But just for full disclosure, I want to give it to you. This is the AMA Guides 6th edition internal medicine section that I wrote. And so I know we're 5th edition state. Sometimes I pull from knowledge of the 6th edition, but just for full disclosure. This is our newest book, which we wrote on the AMA Guides to Navigating Disability Benefit Systems. This is particularly a good book if you have somebody that's new to medical legal, who's new to disability benefit systems, who doesn't know what the difference is between Social Security, long-term disability, workers' comp, PI, something like that. If you have a doctor that says, oh, I'm kind of interested in this field, this would be a good book for them. It's not nearly as large as our other books. It's a nice little introductory piece. Okay?
Dr. Hyman, where do we go to buy these?
You can go to the AMA or Amazon. Amazon, there's even reviews written in the whole thing.
And staff, or any of you guys who are interested in actually reading and are willing to put in the time, I will buy that for the firm, okay?
All right. Last financial conflict of interest. Well, I don't pay consultant any diagrams. I don't think it'll come up. And also, I make more money being in my office than eating all this cheesecake. So, I'd be better there. Okay. All right, causations. Here we go. Which duck is more likely to find a mate? A or B?
B.
Why?
Colorful.
Pretty colorful.
Brighter.
Why?
Sitting there exactly.
Okay, so it is B. Because B has bright orange legs. Vitamins and beta-carotene make those bright orange legs. So they have more antioxidants, they have a better immune system, they have better genes, and they're better able to mate. Right? That's the cause. Right? There's a reason for this. Right? What type of tree is hit by lightning more frequently than others? Okay? So, simple question, but it's been established. What's the cause? Okay? What type of tree? Here's a hint. Okay? Tallest tree. It's our national tree. Why? So this is an oak. By the way, it's our national tree. All you Americans. And it generally goes taller. So people said taller, right? It has deeper roots because whatever you see above is deeper. And then it has a high moisture content, so it conducts electricity. So why does the tree get hit more often? Right? It's taller, it's got water, it attracts, right? So there's a reason, there's a cause. Okay. Who is more likely to have an ACL strain? Okay, so ACL, anterior cruciate ligament in the knee, right? Who is more likely to get that problem? Okay, male, female, tall people, or people with increased tibial slope ankles, right? I'm sorry? Tall people. Anybody else? How about men versus women? Men? Male? Okay. Wrong. Females are more likely to get it, and they have the increased tibial sublingual. So if you look at the ladies, you'll see ladies when they're walking, first of all, in their elbows. They tend to have their arms angled up a little bit more than men, right? Same in the knees. When you look at gals at their knees, and you see the angle that the leg makes with the knee, there's a little bit more angulation than men. That is an increased strength, right? So when they go jumping and doing stuff, they're more likely to get that injury. Okay. Long-term exposure to residential road traffic noise is associated with high risk of MI, heart attacks. Yes or no? Yes? People think that driving through LA with all that stuff is stressing you out, making you more likely to have a heart attack? Yes. It is a prospective cohort study, 57,000 people. Yearly exposures were just above a linear dose response relationship, which means that it was a little bit more likely. Okay? And here we go. Causation may also depend on where you're born. This is the life expectancy based on where you're born. Okay? So you can see that it's better if you're in the blue, right? Got it? It's not so good if you're here in the red, right? So just based on where you're born, just the sheer impacts of your society, your family, your community, where you're born, what the weather patterns are like, what the air quality is like, what the water quality is like, that could determine what's causing your trouble. Okay? How about causation versus correlation? Correlation does not equal causation. This is a graph of the quality of rock music versus U.S. oil production. Okay? So they both go up together, they both go down together, right? But this is a correlation, right? It's not causation. Just because two things happen together doesn't mean one caused the other, right? So please keep that in mind when you're looking at those arguments, right? Here's another one. The divorce rate in Maine versus the per capita consumption of margarine. So if somebody wants to say to me, well, that's because margarine doesn't let you get along with your spouse. Okay, good luck trying to prove that one, right?
Increased weight, less attraction.
Increased weight later, great. And so that's it, you're eating too much margarine, got fat, I'm divorcing. Okay. Correlation does not equal causation. U.S. crude oil imports from Norway versus drivers killed in a collision with a railroad train. Look at those graphs. It's unbelievable, isn't it? You look at those, just, oh my gosh, they're the same things. These are correlations. They're not necessarily causation, right? That's the difference we're trying to get at. What is a cause, right? U.S. spending on science, space technology versus suicide by hanging, strangulation, or suffocation, right? So is everybody going to say, well, we shouldn't spend so much money on science, space, and technology because look at what happens to our suicide rates, right? These are correlations, though. It has to make sense. There are certain rules that we'll use for that. Okay, here's another one. Who knows what that is?
Condor?
No.
Causation.
No.
Is that an eagle or a condor?
No.
Vulture.
This is expect a shooter. Okay. So this is stork.
Stork.
This is stork. By the way, that nest is about 4 feet across. These things are immense. And the stork, this was taken in Belarus, by the way. And look at this. Data from Berlin, Germany, show that there's a significant correlation, see the word correlation, between the increase in the stork population around the city and people having babies out of the hospital. Right? The storks are delivering the babies, right? They're not having it in the hospital, right? So that's the correlation. Is it causation? I don't know. Okay. Long-term exposure to PowerPoints lowers your IQ after 60 minutes. Yes or no?
No. Yes.
Yes.
There's no current study. I could have emailed you my PowerPoint deck and could have read it in 5 minutes, but I prefer making you sit here for now while you read each bullet solely. Point number one, yank as hard as you can, right? So I try not to put people to sleep with my talks, but nonetheless, we'll try to go with it. As you can clearly see on slide 397, PowerPoint poisoning. So you're not allowed to get sick today. According to your chart, you're going to need a transplant. Okay. All right, so that's the first one. Okay. So here we go. So what are we going to do, right? So how about this one? Where the news hits home? I look hard for these things. You know, I spend a lot of time on the internet. You're gonna like, if they don't like my jokes, I'm taking away the cheesecake. Okay. Okay. So this talk, the overview talk, is really just to show you some of the common chapters in the book Causation. Okay. I'm just going to run you through some of the different chapters. This does not go into all the underlying science and detail of how we got to those points and the studies and how to do the literature search. That's a different talk, and I can definitely put you to sleep with that one. Okay, so it's my most dangerous talk, and I just gave that one at Disneyland not too long ago, and thank God the 300 people in the room did not fall asleep, but it's a tough one. Okay, so here we go. Actually, I do think, wait, Jesse, we were talking about chocolate before, right?
Yes.
Oh, yes. Okay, good. Okay, cardiovascular. Established cardiovascular risk factors. Okay, now look at that list. Most of you have probably seen this stuff before, right? Fair? Right? Common stuff, right? Lipids, smoking, hypertension, diabetes, obesity, psychosocial factors. Hello? Psychosocial, it's on the list, right? Lack of exercise, diet, low in consumption of fruits, vegetables, and salad. Okay.
And doctor, I'm sorry, is that risk factors for a heart attack?
This is for hypertension and or coronary artery disease. Could be peripheral vascular disease too. Novel cardiovascular risk. What does that mean? That means that there's some newer ones that are in the literature that do have causation. Now, there is some evidence. This is a key term in the book. Some evidence means exactly how it sounds. That there's some evidence. It hasn't reached the full level, like the biggies of hypertension, diabetes, and cigarettes and all that kind of stuff, but it's still there, right?
So, doctor, I'm sorry to stop you.
Go.
Is some evidence rise the level of reasonable medical probability, in your opinion?
Absolutely depends. What's the case? Is the case that the guy smoked 3 packs a day of cigarettes for 50 years? And then he worked for 1 month? Okay? No. Is it the case that you've got somebody that has documented history of increasing workloads, difficulties with the environment, a whistleblower claim, all kinds of stuff going on, right? Who was asked to do things which were against OSHA standards or illegal, right? And was not a smoker, tried to exercise regularly, didn't have a significant family history, had no history of hypertension, diabetes. Oh, yeah, different scenario. So you have to know what the literature says. Look at these. Highly sensitive C-reactive protein. Coffee. If you're a slow caffeine metabolizer, a genetic trait that some people have, with their difficulty metabolizing caffeine, psoriasis, testosterone deficiency, migraines, hormone replacement therapy for the gals, right? Can put you at increased risk. Anti-inflammatories. Hello? Have you ever seen anybody in workers' comp that gets anti-inflammatories? Okay, so this is a risk. Air pollution can do it, right? So you have to know about that, right? There's insufficient evidence, right? So now we're on the trees where we got nothing, right? It's pretty weak. There's somebody saying, well, it looks like theoretically it ought to do it, but we don't have good studies for it, right? So organic solvents, organophosphates, polycyclic aromatic compounds, and noise. By the way, there is pretty good data for noise and hypertension. Noise and hypertension. So airport workers, right? Construction workers, right? You got to think about that.
Doctor, when you were saying about air pollution, it's not necessarily just outdoor air. We're also talking about interior, like when people work in factories and they have bad air quality as well.
No, that data is based on outdoor air pollution. Okay, now look, this is a table. Don't get all bent out of shape. I just want to show you some of the numbers. This is a level of risk when you're above 1. It's considered an increased risk, right? So that's all I want you to really know about that, but you just see some of the things that we summarized in a table there to let you know what some of the risks are, right? So that you know that it's there, and you can quickly reference that if you want to take a look and see what's going on with somebody, okay? Now, how do you know if somebody's stressed out at work? Is there any data that talks about certain jobs? So the original model for that is the demand control model. Ready for this? Look. High decision latitude, high psychological demands. So, people that can't make a lot of decisions at their jobs, entry-level workers, line workers, assembly workers, people told, stand there, do this 8 hours a day. But they're told, you gotta work fast, you gotta work quick, can't make mistakes, right? So there's high psychological demands, low decision latitude. They're in the high strain group, right? So that group is at increased risk by the nature of their job, right? So it's one of the ways that you can kind of try to assess if somebody in front of you might have a risk based on their job. Fair? Okay. Now, obesity by occupation. So our fattest group, public safety, right? Because they sit at the donut stops. And you can see by the nature of some people's jobs, right, that they're going to tend to run higher body weights. And if you do that, you're going to be at increased risk. Okay? Look at this. Yearly weight gain, right? So it turns out that in Thanksgiving, see that little bump, right? We're all Thanksgiving. And today after Jesse's cheesesteak, I'm really kind of pissed about that. I'm so good on my diet. I was in the gym at 5:30. Jesse, you're killing me. Okay. So anyways, but I practice what I preach. I will get back. But you know, that chocolate thing was okay. So anyways, and then Christmas and New Year's, right? Easter in Germany doesn't seem to have it. Look at this. Golden Week in Japan. The weight goes up, right? So the weight stuff can be variable throughout the year, and sometimes you can have somebody moderate a little bit, but then if they get an injury and their weight starts going up, right, that's going to start the tip of that balance. The risk starts going up, right? So that's why you want to look at that weight history. It's very important, right? Okay, this is my favorite part of the talk. Okay, if you forget everything else, can't forget this. This is about chocolate, okay? There's good data that chocolate probably lowers your risk of cardiovascular disease, okay? And cocoa, which is dark chocolate, can raise your nitric oxide levels, which is an important messenger, so that can lower your risk, okay? Therefore, Hyman says, not Simon says, yes to chocolate. So, this is chocolate by the Bald Man, right? This is the Museum of Chocolate in Havana, Cuba. This is the Museum of Chocolate in Prague. Chocolate is the answer. The question is pretty much irrelevant. Look at this. I love this stuff. This is one of the best of all time. New England Journal of Medicine, one of our top journals. This is the amount of per capita chocolate consumption versus Nobel laureates per country. So you can see if people eat more chocolate, the amount of Nobel laureates they get goes up, right? See that? See, it's perfect, right? So you need to know that, right? Okay. My doctor's sitting 2 rows behind me. You sell chocolate-covered fish oil capsules, right? So, you know, of course I like chocolate, so that's why I'm so glad that I tried that thing and it was disgusting. Okay.
Doctor, Jenny wants to know if you have red wine with chocolate, does it make it better?
Red wine with chocolate. Which Jenny is this? Jenny 1 or Jenny 2?
Jenny 1.
Jenny 1, okay. So sorry, you're not in on this one again. Okay. Red wine with chocolate, absolutely. Red wine has something resveratrol, which is probably a little bit of a beneficial effect. Now in America, you know, we tend to, you know, Americans like, so we take the wine glass and like this, like, so you know the French, like this, and they do 3 ounces, maybe 6 ounces. Us, we start at a bottle and we work up, So the problem is that we tend to overdo it a little bit, but in low, moderate doses, absolutely fine. Okay? All right. Arrhythmias. This is irregular heartbeat. So things that can cause that. Cardiovascular risk factors. Obstructive sleep apnea. If somebody's weight goes up, their risk of obstructive sleep apnea goes up, right? And if that happens, that can cause trouble. If you take any of the cold preparations, weight loss products, which I tend not to recommend, herbal products, big problem area. Family history, you can also see it. The health sensors you built in the watch are not working. According to your stupid sensor, my heart is going to stop beating in. Oh, there you went. Okay. Peripheral artery disease. This is bad circulation leg. Again, cardiovascular risk factors. Look at this. Heavy metal workers are at increased risk for peripheral vascular disease. This is bad circulation in your legs. Okay? Keep that in mind. DVTs, those are the clots in legs. That comes from injury, not moving around, some genetic conditions, but not moving around. So if you have somebody that gets injured and they're told to go home, or they're told they have to have a surgery, or they're in a cast and they're lying around, that's a recipe for trouble, right? Make sure you get them moving, right? It's very important.
So, Doctor, let me stop on that one because that one has hit home for the office here. I once linked a stroke, and it was a very catastrophic settlement on this case or trial decision based on the fact that because he was a paramedic and he sat for a prolonged period of time, he formed an increased risk at forming clots. Would you agree that's reasonably medically probable?
Yeah.
Okay, so that's why if you take a long flight, they tell you to stand up and stretch so that you don't develop that, right?
Right.
So guys, remember that anytime we have a heart attack or any cardiovascular injury that it involves a thrombus or some sort of clot, look to see if that person does a sedentary job or was doing something sedentary for a prolonged period of time, because you can link it that way.
Yeah, I mean, I have to tell you, there was just a research article in one of our journals about sedentary jobs. That even if you exercise, if your job is sedentary, it still puts you at increased risk, as opposed to people who exercise but then don't have sedentary jobs. So when Michael was taking me around this office and showing me the desks that go up, I'm telling you, you should work for the rest of your life. Because
I paid him to say that.
That alone, just having your desk go up and being able to stand or change your position. I mean, what I personally do in my office, for example, is every time I call a patient back, like with their lab results, because I'm still old-fashioned, I still call my patients and all that. So every time, I actually, when I'm done, I get up from my desk, I walk around the corner and throw it in my chart room, and then I go back to my desk for the next patient. It's much more time efficient. Let me just sit there at the desk, keep calling one patient after another. I don't do it. I don't do it because of that data, right? Very important. All right, got this one? Strawberries, blueberries. Oh, all right, here. Pulmonary. This is your lungs. Make sure you're very careful about this. When patients complain about chest pain, shortness of breath, limitations, right? Please keep in mind, right, that there are other causes that may not be in the lungs. First of all, by the way, 4 most common causes of coughing. Ready? Who wants to try?
Almost of coughing?
Yes.
Cold or flu?
What's that? Infection. Smoking.
Nasal drip.
Post-nasal drip. Which right? And?
Yes.
Well, it's kind of inhalational stuff, but you could do it. It's with the asthma. And then reflux disease, right? So you have to know that. So sometimes patients my regular private patients, forget all this stuff. When my regular private patients come in and they say, I've got this cough that won't go away, right? It can be nothing to do with their lungs. And it can be everything to do with post-nasal drip, with reflux disease. Cigarettes always dominate this picture. The source is all known beyond this talk, but just to let you know, there are some resources for you available in the literature that talk about how to get at this. Okay, see this? On the road, there are no shortcuts. Okay, what are some resources? Look at this list. You're going, oh my God, my eyes just went blurry, right? So this just lets you know. They got 26 million citations in PubMed. Look at all these databases that exist. This is very difficult stuff. Look at this. Here's IARC, DIR, EPA, CDC, FDA textbooks, right? There's tons of this stuff. How many chemicals are we talking about, right? When they started this, they grandfathered it in. Look at this. 60,000 chemicals. Do you know what that means? What does it mean when you grandfather something in? It means that they didn't test it. They just said, well, we've been using it forever, gotta be okay. Right? Now, 85,000 chemicals have been approved since then, and about 600 chemicals get approved every year by the EPA. It's impossible to keep track of all these, right? So you have to know how old the chemical will be around. You know those old MSD's reports that say, well, not longer required to have or something, you can still get them. And so you got to know what somebody's been exposed to, right? When you talk about asthma, there are 2 types, okay? Occupational asthma, work-related. Okay, now stay with me. Occupational asthma means that your airways got irritated at work. Got it? Work-exacerbated asthma means that you already had asthma, but then work made it worse. Got it? So when you're looking at the records and say, oh, past history of asthma, that does not mean that the work didn't do anything. They had a tendency. It was already there. It could be all pre-existing, but it's possible, depending on what's going on in the work environment, to make that worse. And then we break it down into different things, which I don't expect you to remember, but it's called high molecular weight, low molecular weight, and there are different chemicals, different dusts, different things that can bring this out, right? By the way, RADS is a very, very significant one. This is where you have people that inhale an acid. This is life-threatening stuff, right? It is sudden, severe, very clear, no question about it, right? So those ones you're going to be able to pick up very easily. Okay, let me show you through other examples. Look at this. There's hypersensitive pneumonitis, right? There's an immunologic inflammation. You're going, what the hell is he talking about, right? So don't worry about that. I just want you to appreciate that there's a lot of different conditions that can come from breathing things that are being exposed. Look at this. Look at these causes, right? Fungi, right? How about the work environment? Was it clean and dry? Or were they working in a moist environment? Was there water damage in the walls? Was there mold seen in the walls, right? You got to know, right? What about these proteins that you can get? Beryllium can do this, right? Things that you have to know about what's going on at the work site. Look at this, the fibrotics, okay? So this is the one you've always heard about, asbestos, right? But these are the ones like silica, coltan. By the way, where do you get this stuff from? Look, you get it from aluminum, cadmium, mercury. Look at all this stuff you can get. Look at all the guys that work with sand, you know, right? Sandblasters, cement workers, right? They're all at risk for inhaling some of this kind of stuff, right? This is the kind of stuff that get into your lungs and cause these particular troubles for you, right? COPD, okay, chronic obstructive lung disease. That's the classic cigarettes, right? Is it possible that a work environment can worsen that? Yeah, it's possible, right? But cigarettes is always going to tip the balance and make it much more difficult. And then let's look at this. Firefighters are increased risk, right? Concrete manufacturers, right? Told you about that, right? These people are at risk for this kind of stuff, right? So look at that occupation. It can make a difference of what you're thinking about, right? Last one, the cancers. Again, silica is possible, asbestos, we talked about that, ionized radiation, cigarettes, right? So ionizing radiation, people who work in the medical field and around all the machines that are being used for diagnostic purposes, right? Air traffic controllers, they're surrounded by this stuff, right? Right? Ionizing radiation, gotta know about that. Okay, here's one you don't remember. Bronchiolitis obliterans, okay? So what happened here? There were people working in a factory in Arizona, and they were developing, you know those little packages you get of the frozen popcorn, and you throw it in the microwave, and the bag pops up, and it gets hot, and you know all that kind of stuff? One of the flavorings in that actually caused you to ablate parts of your lung. So you had these people that were opening up the microwave, opening up the bag, going, oh, that great popcorn, wipes out part of the lungs, right? And it was just from a flavoring, just a flavoring in these things, right? So of course they had to quickly pull that off the market and figure out what the hell's going on. But that lets you know some of the stuff that goes on there, right? Okay, we talked briefly about obstructive sleep apnea before. Remember obesity, weight gain? Look at the things it's associated with. Hypertension, strokes, deep vein thrombosis, diabetes, metabolic syndrome. By the way, some of it's more common in drivers, seamen, and cooks, right? Drivers, you see the truck drivers and stuff like that. Okay, so they're going to do that.
And doctor, let me stop you for a second. Guys, this is really important. Almost all of our injuries, we see people who used to be physically active and now they're no longer physically active. They're stressed, so they eat more. We can absolutely link weight gain to industrial causation, which then we can link sleep apnea or those type of issues. Then we can link hypertension. This is how we work up our cases.
Yeah, there's a big hook for you guys on your stuff. Yeah, absolutely. Okay, and then so you can see it with that. Okay, rest up. That's a sleeping, folks. Okay, you're gonna like this one. Okay, if you can't hibernate, I'm going to refer you to a sleep disorder clinic. That's good. That's good. Come on, Michael. Show that to that cute little daughter here. She said, that man's a funny man, Dad. All right. Okay, here we go. Fanta, Coke. Okay. All right, here we go. Look at this one. Fasteners. See that? Okay. All right, so rheumatology. Okay? So osteoarthritis. So folks, this is the aging of your bones as you get older. Okay. First of all, everybody who went over to do this stuff says, oh, I got one of those. Okay. So, osteoarthritis tends to be into a single joint at a time. Okay? So if you have somebody that says that both sides hurt equally in the same locations, that is often not going to be osteoarthritis. Okay? Osteoarthritis is one that as we get older, you see a little crooked, but it's like this part of this finger, this part of this elbow, this part of this knee, that kind of thing. It jumps around the body. Okay, that's osteoarthritis, the aging of the bone, degenerative joint disease. And things that can cause that. Genetics, women are at increased risk. Obesity will do this. If you don't have good nerve endings, right? If you're deconditioned, right? And you're not having muscles. Why? Very simple. Very simple. If you don't have the muscles protecting your joints, the joints have to do more of the work, right? So that's why the exercise becomes so critical, right? Rheumatoid. Okay, now the rheumatoids, those are the ones where it's bilateral. Both sides of the body, same joints in general together, okay? And genetics can do it, smoking can do it, silica can do it. And look, here's our little term, right? Some evidence, see that? Excessive typing, lifting, ergonomics, stress, solids, pesticides, farmers, some evidence in those groups. Got it? Okay. Lupus. Lupus is can be brought up by UV light exposure. So therefore jobs with heavy sun exposure. Right? Lupus, by the way, lupus by itself is an autoimmune condition. What does that mean? It means your body produces a protein that attacks it. Right? So that's usually... Look at this, I'm getting violent over lupus. So that's usually when you're going to have troubles with... thank you. That's usually when we're going to have troubles with both sides having this kind of rash or difficulties, right? There are some drugs. Look at this. Alfalfa sprouts can do it. Alfalfa sprouts. Doesn't sound like a very serious condition, but that's what it is.
So, doctor, really quick, if one of our clients develops lupus and they're a field worker, a farm worker, or have significant outdoor exposure, are you saying that we should take that case and use you as an AME to link it?
I'm saying that you should name your next child after me. That's what I'm saying. Okay. All right. Who do you think put this table in your place? Okay. All right. So anyway, keep that. Now, fibro. Okay. So that's the females, increasing age genetics. Got to check the past history. This is the strongest predictor we have in the medical literature of patients who go on to have symptom magnification, delayed recovery, chronicity of illness, fibromyalgia. This is the past history of abuse, unfortunately, but that's what it is. By the way, there's some evidence that you can get it more likely if you're diabetic. Okay. All right, osteoporosis, thinning of the bones. If you don't move, if you're told to go home, if you're injured and you're lying at home for months, if you're not able to work, you're not able to exercise, right? If you can't move around, you're going to start thinning your bones, right? It's very important that you always get up. Look at this list of medicines, folks. Look at that, right? These are all things that can cause or contribute to thinning of the bones, right? So you want to know about that. You want to know if somebody's on anything. Look at this, the SSRIs. The proton, anybody's ever seen somebody on a proton pump inhibitor, right? I mean, you know, this one drug alone, this is the #1 drug in the world. You take the group of proton pump inhibitors is the #1 drug in the world for sales, right? You know, all the world is popping these things so that they can keep getting fatter and drink more, right? So that's what's going on there, right? So keep that in mind. It's things that will cause this. Okay? Rest out. Okay, you gotta look at this one carefully. I saw this in London. The phone was out here. See this? The phone booth with the phone there. I said, you know, come on.
That's funny.
Yeah, come on. Now, I don't, they're going to say, oh, you Americans, what do you know? But I'm saying, what do you guys know? I mean, it's like, you know, come on. It's like weird. Okay. GU. Okay. So, cancers in the kidneys, things like that, right? So, kidney cancer, smoking, obesity, high blood pressure, bladder cancer. Cigarettes is a big thing, but don't forget, rubber and dye industry workers can do this. Prostate cancer, testicular cancer, right? Stones. There's some evidence that you can see it more likely in lifeguards. But if you have somebody that's working in a hot environment, not able to regularly hydrate, right? That's going to be the person that's going to be at risk for stone formation. That's why I'm always telling people, you know, people are saying, well, Dario, I don't want to lose weight, whatever, you know. So I say, well, make sure, first of all, you're drinking a lot of fluids, right? Because if you just drink a lot of water, it's going to continuously flush your system, and it's going to leave it a little more likely that you're going to pull out some solutes, some particles that could actually help you lose some weight, right? Also helps with bowel movements, so very important. Okay, acute kidney injury, short term. So look at this: antifreeze, plastics, herbicides. Keep in mind, by the way, the Chinese. Okay, now the Chinese are really masters at bending every rule in the world in our medical world. So what they did is they took baby formula, right? And they became this mass producer of baby formula, the powder that you put in, you know, the milk for mothers who are no longer breastfeeding. So what they figured out was if you take these wood kind of things and then you break it up, the melamine is actually looks like a white powder and looks like this. So they put it in there as a filler. So every jar has less powder for baby powder and more melamine, so you can sell more and make more money, right? So the problem is that's toxic, and so there was causing some kidney injuries in that stuff. So be careful when you buy stuff. Make sure you know where it's coming from. Chronic kidney disease, hypertension, diabetes, glomerulonephritis. You can see a risk with lead or cadmium. Voiding. You can have this occupationally if it's a low spinal cord injury. Make sure. Now, this is not an L3, L4 disc, a 4 millimeter. Don't give me this crap, right? I'm talking about big time injuries, paraplegia, something that you've got significant injury in there. You can hit some of those nerves. The nerves that do this, by the way, are called the pudendal nerves. Pudendal nerves. So that's one of the ones that can do this if you got a more serious injury. Okay, infertility, sexual dysfunction. 15% of couples have complaints of this. Both male and females are equal. Some risks for this are smoking, obesity, alcohol, genetics, some ionized radiation. There's some insufficient evidence. So this is a whole big area right now. These endocrine disruptors, where you read these things about BPA and all that kind of stuff, about taking plastic, recycling plastic, getting safe plastics, not having plastics for your kids, all that kind of stuff. So, theoretically, there should be some stuff about that. Realistically, it's very hard for the data to really catch up to that, unless we all think that's good. Hypertension, diabetes, psychological injuries do this. Long-term opiates. Long-term opiates. The medical literature is very clear, by the way. There is no good data for long-term opiates. I was just screaming in another supplemental report that I signed off today on some guy that is on long-term opiate therapy, should not be on long-term opiate therapy, and all I do is say the truth and piss people off, and that's my job, right? But I don't care because the literature's right. But I want to show you how you measure sexual dysfunction in men, okay? It's called the manogram, okay? So, if women... I knew you'd like that.
I've actually had a mammogram, a real one too. It's kind of painful.
So you see, that's how you know that medicine started as a male-dominated profession.
Yeah.
We came up with the mammogram to torture women.
Yeah.
So I'm getting back at them with our mammogram. That's our mammogram. Okay. All right. And here we go. Rest out. Okay. Watermelon, corn. Got it. Okay. GI. This is the stomach, the colon. So look, we have this table in the book just to show you some of the stuff that you've heard about. So dyspepsia is where you have feelings of there's an upset stomach, very vague, hard to diagnose and stuff like that. There is some evidence that stress will do that. Peptic ulcer disease, that's the home of anti-inflammatories. That's the home of anti-inflammatories. That's the big one. Helicobacter pylori, that's an infection in your stomach, should always be checked. If it's there, it's not occupational. Reflux disease. Obesity is a big one. Obesity is a big one, right? That's going to be, basically what happens is, as we add weight, particularly men tend to be the apple, right? So men go here, right? In the middle, right? Women tend to be the pear, more like down here, right? So men, when we do this, there's something called the Place's law. So the larger your stomach gets, it's a relatively greater increase in the pressure in your stomach, and it pushes the stuff back up, right? Irritable bowel syndrome, strongly related to stress at work. Shift work may actually do it. In inflammatory bowel disease, this is really insufficient data. And hernias, isn't it interesting? The literature actually says that it's not clear that somebody's job causes a hernia. The literature actually says that. Now, having said that, I'm always like looking at myself saying, I just can't believe it, because it just doesn't make sense to me. I'm being honest about the literature, but what I usually say in my reports is, look, I think it's more probable that there's a contribution to it, right? Because usually it's just the lifting, the grunting, the weight, that kind of stuff. Okay, that's a rest stop. Look at this. Floats on water. Okay. Here we go. ENT. Ready? ENT. So this is hearing loss. There are national standards for this. By the way, for all of you that, I know you're all pure souls, and nobody ever went to rock concerts, or went out to the desert for Burning Man or Burning Bush or Coachella or releasing. So I know none of you did that. I'm just saying other people do that. So you do that, and you're guaranteed to drop off your high frequency hearing very early in life, right? So you're going to start losing the pitches at the higher range, and that's what's going to be your gift. And just to also let you know, some other things that can do this. By the way, high dose aspirin can cause you to lose your hearing. High dose aspirin, right? So please keep that in mind. Okay? Cataracts. Oops. Oops. There we go. Yeah, here we go. Yes? Yeah, here we go. Here it goes. So keep in mind, there's different ways of looking at this hearing loss. OSHA has guidelines for hearing conservation. So there's actually numbers. I don't expect you to remember this. All I want you to remember is that Hyman said something about that if my guy says that he was in a noisy environment, there's some numbers, right, about how long somebody can be exposed to certain levels. So that's real easy, right? How many hours were you doing this? And then you send somebody and say, we demand to have an acoustic evaluation at the work site. And they just go in there with a little decibel meter and say, okay, that's the number, right? And then you know real quickly, is it there or is it not there, right? So those are the numbers that you can know about. By the way, you can also see with certain types of heavy metals, you can do this, right? Okay. Cataracts. Those are the blinding in the eyes, right? That little lens in the middle where you start getting stuff going in there, and we all kind of get that a little bit, all of us, as we get older. It increases with age, smoking, hypertension, diabetes, UV light exposure, steroids, ionizing radiation. There's occupational risk. The airline pilots, astronauts, physicians, right? All the physicians, because we're always doing those technical stuff in the labs, right, with the ionizing radiation. So that's a risk group that you're going to want to know about. Okay. Okay. Nose and throat. All right, so look, some patients will complain about sick buildings or building-related illness, okay? So what this means is people are going into their work and they're saying, I'm not feeling well. Something's wrong. Every time I go in there, I have troubles. When I'm not there, when I'm at home, when I'm at the weekend, I feel better, right? You heard that before? Okay, all right. So most commonly, this is going to be due to ventilation, moisture, temperature, airflow, oxygen content, those common things. So just like you know how Michael kindly went and said, oh guys, I turned down the air in here to cool it off a little bit. Just the mere fact that you've got ventilation going helps people a lot, right? Just the fact that you got that going, it can help you a lot, right? So this is some of the things that could be operating there. There are over 1,000 volatile organic compounds in every home environment. By the way, you're doing all this beautiful construction. Let's be honest. You've got a lot of volatile organic compounds going off into the air right here, right? So what is it? You walk in a place, you go, it smells new, right? You know, those are the volatile organic compounds, right? So for the vast majority of people, it's no concern at all, right? They don't cause anything at small levels. You know, we have a lot of circulation going on, so it's not a risk, right? But you could see why somebody might report troubles or have trouble, but there are certain industries that can do that too, right? So smelling these things, experiencing these can be bad. Here we go.
Doctor, any data on having live plants in an office that would help with air quality?
Yeah, so the data is on live plants is it probably is beneficial. There are some times where what will happen is you don't get something for nothing. So when you have exposed dirt, you're also having more of a milieu for mold. So you can have some more mold and fungus exposure that could be aerosolized, right? Not necessarily bad, and certainly you're going to get the plants giving you the exchange of carbon dioxide for oxygen, right? Got it? Okay. What's that stench? The cologne you're wearing, and we're going to fish back here. Okay. All right. So that's me and some of the boys more recently. All right, and that's it. Mr. Bond. Okay.
Yes.
Good.
Thank
Let's
you very
go.
much.
All right. So we have a little bit of time for questions, comments, alternative speeches. Anybody got anything?
With regard to the sleep apnea, I mean, like personally, I have sleep apnea. I sleep with a CPAP machine, and how I know I lost a lot of weight, and I've been gained weight again, and so I'm back on the machine. But I had actually got on the machine. There was a certain weight that at that weight I didn't need the machine anymore. So I had to test that.
Right.
How do you determine disability for that?
Well, you know, it's just basically a training experience because in the AMA guides, you know, people usually go to the neurology chapter, but quite frankly, the section is in pulmonary, and so you know, generally I try to take a look at there's this certain number called apnea hypopnea index, which is how many interruptions there are, and also look at how much oxygen is being dropped during the night, and that's how you get that number.
And the machine will tell you.
The machine will tell you, or you do a testing. I do a portable testing on patients.
I have a question.
Please.
We have someone that developed stomach cancer and they worked delivering gas products like petroleum for like 20 years,
Uh-huh.
and weren't able to get the MSD sheets. We absolutely need those to read the link. Or
Yeah, I mean, it's very helpful. The other question is you might be talking about the gases that he's delivering.
mm-hmm.
I'm thinking in my mind
Mm-hmm.
about the fact that this person was out on the highways driving for 20 years. And I'm actually a little more animated by the environmental exposures of the road rather than what was actually being transported. Is that clear the way I said that? Because sometimes if you're transporting gases, these could be in sealed containers that, and it's behind them and they're just, they're just dropping the containers off. I mean, because I have tanks in my office and they're delivered by a guy, they're sealed. There's no way to get the gas out of there until you go through all these different nodules to, open them up and all that kind of stuff. So, I'm less interested in that.
Okay.
I'm more interested in what's on the highways. Right?
Guys, any of you guys have any specific cases you're working on right now with internal questions? Now's the time to ask it.
I have an interesting question, doctor. I have a case where she was diagnosed with esophagitis, so the lining of her esophagus has gone down.
Uh-huh.
It's a very recent diagnosis, about 10 years. There's not much research in it. Now, I sent it to an AME. She worked 20 years breathing in chemicals. Sometimes she didn't even wear a mask. The doctor says since there's hardly any research on it, he can't link. Now, she worked 20 years breathing in all kinds of chemicals. She makes panels, solar panels.
Well, do you know what chemicals she was exposed to?
I have the MSDS sheets. I sent them over to the doctor.
And you sent them over to them?
And he's washing me out.
And the MSDS reports do not have any relationship at all?
I mean, it says that if you breathe it in, obviously there's problems with the lungs.
Respiratory irritation,
Respiratory,
but not the eosinophilic.
yeah.
You said, did you say eosinophilic esophagitis?
Yeah, there you go.
Oh, yeah. That's what I thought you were talking about. Yeah.
That's exactly what he said.
Say it real quick, right?
I just want you to know I speak Spanish.
So, Doctor, another quick question: is there a common internal ailment that would provide significant whole person impairment and/or future medical for a client that you think is often missed and that could provide a very big permanent disability award? Is there something that you see routinely missed by other firms? Like other firms understand the upper and lower GI issues, they understand the aggravation of hypertension, that type of stuff. But is there something that you think that there's something there that firms are actually missing?
Who is it who asked me that question? I might have to give that some thought, but as I sit here right now, I can't think of something. Now, maybe, that could be a referral bias. In other words, who sends folks to me, right? So it's going to tend to be the people that are at higher levels of work. The guys that are, kind of maybe not really doing it, not used to the high-end literature, the resources, the AMA guys, that kind of thing, they're probably not going to be as in tune. So I have had some of those where they ask me, I'll tell you one thing I would do. On every single one of your cover letters, you should always write the word internal.
Which we do.
In other words, I get these cases all the time that say, please evaluate this person's reflux, which is fine, right? So that's what you asked for. Now, I'm an internist, right? So I'm looking at this and saying, well, this person, look, they've got a few elevated blood pressures here, they've got this other history, but I figure, okay, nobody wants any comment. So even as a matter of fact, what I will do to try to tell some dummies out there is I'll even list things saying, possible hypertension, comments deferred. And I'll even put something in my discussion say, this patient was referred for selected internal medicine conditions. If the parties require comment to narrow the condition, a reevaluation will be necessary. What I'm saying is, you better take a look at your client and look what's going on here to really know the full picture of their information, right? That's what it is.
Okay, so if we're sending anything to you, we should always make sure to have internal, and then maybe even put a little catchphrase that says, if there are any other internal ailments that maybe cause or aggravate on an industrial basis, please address it.
You could say it that way. For me, because I read those cover letters 3 times, if you just have the word internal, it's fine. Okay. And the other thing is, on your cover letters, it should say, I love you, Mark.
It helps. That's under my signature.
That's right. I mean, I don't want, just don't toss me like, Garrett, toss me a bone.
Hey guys, so first off, Doctor, thank you very much for your time. I greatly appreciate it. And all of my staff, make sure that he's thrown out as an AME on any single case that we have. Okay, so let's make it rain on him
Quick question.
to help pay for that
All right.
bakery.
All lawyers, did all lawyers sign this?
Yep, we got that, but we have to do the activity evaluation form for
Okay,
you right now.
so all lawyers, don't forget, make sure you fill out your certificate of attendance because you hold on to that for proof. And then this one you have to get back to me because I have to have that available to the state for my stuff.
And once again, guys, if anybody wants any of the books that he's authored, and you guys are going to legitimately read it, I will pay for it. And we'll get him maybe the quarter he makes on royalties. Doc, thank you very much. I really appreciate it.
Okay, guys.
Also, he's a huge proponent of flu shots. So all of you guys who haven't got your flu shots,
Yes, that's true.
okay?
Matter of fact, the rule is everybody knows that I have lawyers that come to my office specifically in the fall because they know they get their flu shot, and I have lawyers that will not come and take my deposition in the fall because they don't want a flu shot.
I got a flu shot by him recently at a cross-ex. Yeah, wouldn't take no for an answer. So I learned real quick. I was like, all right, get it over with.